Colospan for better colorectal surgery. 1.36 million cases are diagnosed each year, making colorectal cancer the world's third most common cancer. It is an equal opportunity killer. Usually, colorectal cancer is treated with surgery, in which the diseased portion of the colon or rectum is resected, and the two healthy sections are reconnected via a colorectal anastomosis. One of the most devastating complications associated with colorectal surgery is anastomotic leakage of colon content into the abdominal cavity, and this occurs in a high percentage of cases. It leads to longer hospitalization, a frequent need for reoperation, and a higher mortality rate. From an economic perspective, a leak adds $50,000 to the treatment's cost. To prevent leakage, surgeons are using external bypasses, also called diverting stomas, for approximately 70% of their patients. To prevent the colon's content from reaching the anastomosis site, the surgeon extrudes a loop of the small bowel from the abdominal wall and connects it to a bag for collecting the patient's feces. Besides making life very difficult for patients, the diverting stoma is far from perfect. 17% have complications, including 2% with a leak rate and 3% that require reoperation. And closing of the stoma requires another surgery.
If we could find a secure way to avoid diverting stoma, this would truly be the holy grail of colorectal surgery.
Anthony Senegor, MD. Colospan has developed the CG100, a single-use temporary intraluminal bypass device designed to reduce contact of fecal content with the anastomotic site. After the diseased segment is resectioned, the Colospan device placement begins through the placement of a single silicone ring around the colon. The surgeon completes the anastomosis as planned. The device is then inserted into the rectum using a delivery system. Once deployed, the thin silicone sheath is positioned by inflating the 3 balloons, and the delivery system is extracted from the body. The ring connecting tube is fixed outside the abdominal wall, just like a surgical drain. All colon content passes through the sheath. Even if there is slight anastomotic dehiscence, there is no spillage into the abdominal cavity. The diameter of the balloon is slightly larger than that of the ring, preventing the sheath from moving downstream beyond the ring location while still allowing it to move freely inside the colon, preventing damage to the colon wall. After 10 days, when the risk for leakage is reduced, the device is extracted with no need for surgical intervention. The ring is opened from the outside and extracted like a surgical drain. The balloons are then deflated and the sheath is pulled out from the rectum. Colospan for better colorectal surgery.